Adult learning theories are applied throughout university degrees and occupation training. Approaches vary depending on the field of education or career, particularly in the case of healthcare, where there is a higher focus than most other fields on the integrated workplace experience. As a paramedic student, you spend 2 to 3 years studying theory through textbooks, lectures, and tutorials, and experience only approximately 18 weeks of practical study on road. Whilst universities attempt to mimic the on-road experience in classes, there is a vast difference between studying theory on out-of-hospital management for different scenarios and actually being part of the team that is face-to-face with a patient in an emergency. Whilst traditional theoretical study has its place in building a strong base of knowledge, the ability to be able to reflect on real-world experiences and conceptualize a skill or scenario is invaluable. This concept of reflection and solidifying knowledge through experiences is a common concept in the majority of adult learning theories. Reflecting and learning from one's practice is not only important for university students, but something that should be continued through one's professional career. Arguably, the most famous adult learning theory is Kolb's experiential learning theory, in which he describes the facilitation of learning and knowledge construction in 4 phases: experience, reflection, theoretical conceptualization, and finally, experimentation. Education of paramedicine through universities supports Kolb's theory, with integrated workplace learning periods being a cornerstone of the degrees. However, not all experiences are associated with learning. Kolb's theory distinguishes that the act of reflection is what constitutes a learned experience. The ability to self-reflect is a valuable attribute in a clinician. However, there are some cases where a clinical debrief with other health professionals is more appropriate. These can be formal debriefs with senior paramedics and other emergency service professionals in a meeting room, or a casual reflective chat with your paramedic partner in between jobs. A formal clinical debrief often occurs after a high acuity or significant event and allows the treating team time to reflect and discuss their experience. Toes and Martin highlight the importance of having structure to a clinical debrief and list 5 attributes to help facilitate this: having an experienced leader, an appropriate and safe environment, using it as an educational tool, reviewing the actual event, and addressing the emotional aspect of the event, and if there is any need for a follow-up. It is recommended that all 5 of these attributes are addressed in a clinical debrief. However, in some certain situations, it may be more appropriate to focus on certain attributes more than others. Situation-specific debriefs that focus on a particular attribute does not lessen the effectiveness of the debrief for those involved. Research shows that debriefing after a possibly troubling case, such as an expected or unexpected death of a patient, has the ability to have a positive impact on psychological outcomes for students and healthcare professionals who are involved. This positive impact on one's psychological outcome can be classed as post-traumatic growth. Post-traumatic growth can be defined as a positive psychological change that may develop after a challenging circumstance in one's life. Post-traumatic growth is highly prevalent in healthcare workers, with approximately 76.8% experiencing post-traumatic growth 7 months into the COVID-19 pandemic. This type of positive psychological impact is reliant on a debriefing method that focuses not only on the educational aspect, but also includes the other 4 aspects: having an experienced leader, an appropriate and safe environment, reviewing the event, and addressing the emotional aspect. This evidence clearly highlights the importance of a clinical debrief and the benefits of the experiential learning process in the paramedic profession. There is currently no standardized form of clinical debrief model in place for paramedics. Current clinical debriefing in a clinical and simulation environment are heavily based on the clinical details and events, with the emotional and psychological reactions either an afterthought or non-existent. This approach to clinical debriefing is not beneficial to healthcare professionals and students' psychological health. Paramedics are often first on scene and are exposed to situations that can be quite confronting. This is what separates them from other healthcare professionals. Hospital staff encounter patients in controlled hospital environments. This is different to paramedics. Wilson and Ashbury recognized this distinct difference and thus developed a distinct debrief model specifically for paramedics. The idea is to start in the inner center circle and work out from there. Including the patient at the center of this model helps remind paramedics that the patient is the focus, and ensuring that patient-focused care principles should always be central in the care and treatment provided. This debriefing model places the initial emotional reaction to the event of the paramedic alongside the observational recollections as the first phase. This allows the feelings, emotions, and immediate reactions to the case to be immediately expressed and allows the healthcare professional to work through the emotional side of the job sooner and become able to think clearly about the case and begin to reflect and analyze the clinical side. The second phase is the reflection phase. The goal of this phase is for the paramedic to reflect on their own performance as well as their team's. The focus of this phase is to become self-aware and identify any positives and negatives of their clinical approach. The next phase is focused on the analysis, focusing on their performance and understanding the influences on their decision-making and actions. It is through this analysis that paramedics may improve their understanding and decision-making in future practice. The final phase is the application phase. Its focus is on the participant considering their past experience and learning and applying it in future clinical situations. This paramedic approach is clearly based on Kolb's theory of experiential learning and proves a valuable guide to assisting paramedics in their clinical debriefing and experiential learning. Whilst this model is not practical to be used in every job, paramedics should use their own judgment to determine if the time and place to implement this model is appropriate. Whilst experiential learning is a vital aspect of paramedicine, it is imperative to treat every patient holistically and as an individual. It is important to not anchor your specific diagnosis of a patient based on similar symptoms of a past patient. Acknowledge that every patient is different and pathophysiologies may present differently in different patients. In a similar vein to experiential learning, it is important to recognize that debriefing is not a one-size-fits-all approach. One job might elicit two completely opposite emotional reactions in different clinicians. If a fellow healthcare professional is expressing a need or desire to debrief about a particular job, it is important that you are open for the discussion. A clinical debrief approach should be adapted based on the individuals involved and potential impact of the job. A clinical debrief is a valuable tool that helps facilitate learning and can be used in cases of varying size and severity. A clinical debrief should focus on the potential emotional and psychological aspects of a case and not just the clinical features. The goal of a clinical debrief should be to promote experiential learning and in potentially traumatically impactful situations, promote post-traumatic growth in healthcare professionals. As a healthcare professional, it is imperative that the learning and personal growth does not stop once university has been completed. Paramedics should actively seek out consultation and feedback regarding cases with senior paramedics and other healthcare professionals. Effective and patient-centered self-reflecting and clinical debriefing in appropriate situations should be utilized by all healthcare professionals in order to prevent the stagnation of learning and encourage experiential learning.